Well, happy, beautiful, amazing day. Dr. Bob Rakowski here out of Houston, Texas with Dr. Matt Ormond. I'm excited for this conversation today. Matt has over 20 years of clinical experience. He likes to say, first and foremost, that he's heart-centered, and that really is the key to all of life. He's helping people to identify their values, how to be their best self in service to something bigger than themselves. And Matt, in our conversation beforehand, you help a lot of people a lot of different ways, but one thing that really pushed my buttons, you have a program where you help teenagers discover their values. Let's talk about that, because I think not enough of us are really in tune with why we're here.
Yeah, Dr. Bob, first and foremost, thank you for having me a part of your platform. It's such an honor and a privilege to be with you. And thank you for the opportunity to talk about this program. I saw, I have teenagers, and I have the privilege of teaching an anatomy and physiology class at a local charter school. So I'm in touch with, and I teach 1 hour a day. I'm in touch with teenagers, and I see a plight that's happening here, that we are losing these teenagers. They are struggling. And so I wrote a program that helps to identify their core values, which there's beautiful neuroscience, neurochemistry inside of that. As you change where that brain fires from the hindbrain, the fight or flight centers, back into the midbrain, where value centers are located, you can change neural pathways and help them to think differently. And from that perspective, getting their values and helping them to really carve out what those values mean to them, we can then make identities that are in alignment with those values. And now we're changing the whole organism.
There's so many things I want to really reach into on this. I really like Dr. John Demartini.
Yeah.
And one of the things he says, if you need to be reminded to do what you say is important to you, what you say is important is not important. And I think people are really not as connected as they need to be to what's important. So I want to go with why the disconnect? What do you think is going on? Why are so many people so lost? And it's not just teens, that's for sure.
Yeah, that is for sure. It's not just teenagers. As practitioners, you and I, we've been students of pain for our entire lives, which is an interesting aspect. To have that privilege to look at pain not just as a nuisance or something that needs to be killed or numbed or ignored, using pain as a thread that connects us to the actual source of a problem that can be corrected. And so with that in mind, I pulled on those threads with teenagers, and identity is really what's in the balance here. And I've heard it said this way so succinctly, and I'll give credit to Sean Callaghy, who helped share this, the leader of Unblinded. But he says, if we don't define our identities, the world will define it for us. And I think here we are in the world, these teenagers, adults as well, are allowing the world to define their identities. And those identities are misinformed at best, and sometimes quite sinister.
So now what's the process? What do they actually do? How do they find out what's important to them?
Yeah, that's a good question. So there is a value discovery, and there's some artistry in that, but it is asking questions. It's asking questions like, what top 3 things do you think about most? What three things do you talk about most with others? Where do you spend your most time on? And we go through a series of questions like that. And it allows them to kind of think and put out what's top of mind. And at the end of that question and answer period, we will collate the thing that comes up most on that list. So it could be relationships, or it could be education, or it could be their sport that they're playing or their activity. And that becomes, we form values based on what frequents that list the most. And once we see, like, we'll use relationships. That's a high value typically with teenagers and with all of us. And I'll then ask, what does that mean to you? What's the primary meaning of that? And then we'll define it down to a secondary and then to a tertiary level. And so we connect those values then with anchored into, let's say, relationships equal fulfillment. And so now in their brain, in their nervous system, they know that relationships are high value, and they know why it's a high value, because it equals fulfillment. And so they need not seek or wonder how to fulfill themselves. They have it defined for them. And what's beautiful with that, and you've experienced this with your patients, is there's a certain visceral feeling to it as well. When you get into truth and recognize that, there's a feeling that comes with that. So not only are we finding these values that they see right in front of them, but they can feel them.
Well, now let's build a bridge to pain, because there's many different types of pain, right? We often see people with physical pain. Maybe emotional pain is worse than that. But
Yeah.
so where do you see pain fitting in on this as maybe a messenger to help people get their life in order? How do you use it?
Yeah, great question. So, I use the analogy of a rock in our shoe. So, the rock in the shoe is it's there for us, and we've all had that experience enough times. We know what to do with it. There's an intervention that needs to be done, and if we ignore it, if we take enough Tylenol, it doesn't just go away. And so, that's a simple intervention. And what's beautiful about that is, as we shake the rock out of our shoe, we put the shoe back on our foot. The very next time we put pressure on that foot through that shoe, we're assessing, is that rock still there? And as soon as we recognize it's not there any longer, by the very next step, we've forgotten about pain entirely. Like, that pain no longer exists. That was a phenomenon that I recognized early in my practice, my professional years. And I didn't recognize it at first, but it happened probably a dozen times before I recognized that, hey, there's something happening here. But a patient would come in with significant pain, enough pain where they would stop their busy day at work. They'd be willing to pay money out of their pocket to get relief. And we'd follow up with them the next day or the following day. And what came back was surprising. It was as if they forgot they had pain. And initially, I'm like, well, that seems silly. How did they do that? And once I really started understanding more and more about pain, I recognized, like, oh, so pain is a mentor, pain is a teacher, pain is a guide. And so if we look at it through those lens, pain, and I'll speak to my personal life, pain has always led to acceleration. I would say most, if not all, of my accelerations I've had in life have come because of pain points, these metaphoric rocks in the shoe. And so, with that being said, I'll pause there, actually, because I'd love to hear your thoughts on that. I know you have a lot to say.
Well, one, pain is what brings people in, right?
No
But
doubt.
I wanted to ask you, how often are people really connected to what caused their pain? Because I'm going to suggest that the vast majority of time, especially when it's chronic, people don't realize that they haven't made enough good choices to manifest the health they deserve. So they come in with pain, they come in with imbalance, they come in with fatigue, they come in with poor sleep, and they don't realize that they're not eating right, that they're not getting the exercise, that they're not managing their stress. But, I think pain is the most actionable signal that we get. And so, I really like your metaphor about the stone in the shoe. People know it. They also know to resolve it. But now let's go to your pain patients, and then maybe go to emotional pain with some of these kids, and figure out, how do you build a bridge to the person being fully responsible for what they're dealing with? Or is that a priority?
No, that's where healing really is. That's what it's all about. Because we could adjust. With chiropractic being my background as a body worker, I can get muscles to open up. I can get blood flow to an area. I can get a joint to move, and you get relief, which is beautiful. But what I noticed, what I'm sure that you were present to, is that person would come back in 6 weeks later, 6 months later, 18 months later, with very, very similar patterns. And so while we cause relief at some point, and this is without any disrespect or denigrating this beautiful profession that I serve in, but we were an expensive aspirin to this. And so I've learned to just ask more questions and seek more. And I think, I talk in terms of body, mind, and spirit. And chiropractors, we are fantastic at aligning structure. And when the structure is in good alignment, we move well. Muscles are working well. We feel better. But body, mind, and spirit, and I use the word spirit and nervous system interchangeably quite a bit. There's enough parallels there that I can pull on those threads. And the further misaligned we are, whether it's structurally, whether it's mentally, or whether it's spiritually, the further misaligned we are, the more pain comes in. And so that pain is a beacon. It's a beacon to us for some change. Something's, whether it could be diet, it could be lifestyle, it could be sleep patterns, it could be a relationship, it could be a work that no longer is rewarding to you, and you've lost the purpose. But that pain will enter in, and it will call our attention. So just like pain is what brings people in, and the artistry and the beautiful practice that we are engaged in is helping them find the actual cause of that pain. And I'll share just yesterday I had a new patient that came in with she's been suffering from rheumatoid arthritis for over 37 years, and she's late 60s now, and so pain is a permanent part of her life. is what she has declared. Uh, and as we walked through this, we found some emotional issues in her body that were at the root of her pain. And what's beautiful as you get to these areas, the waterworks just open up, and doesn't have to be the pattern for everybody, but in this instance, waterworks just open up, and she starts breathing differently. That diaphragm opens up, the nervous system changes, and she left not cured from rheumatoid arthritis, but she left being a whole different organism, feeling lighter and feeling relief at a deep level with homework of things that she ought to engage with. And here's one thing I'll share with what we found with her is she resonated deeply with vulnerability equals weakness. And so she felt this diagnosis made her vulnerable and therefore weak, which is a false identity for sure. And with this nervous system slash spirit, it will recognize false identities. And just like a rock in the shoe, it will tell us, hey, this thing's not in alignment. And at some point it will scream, this is not in alignment with us. And so, these autoimmune, the framework for autoimmune, and I'm not trying to turn the tables upside down entirely, but this nervous system that you and I have studied for our lifetimes, it doesn't just willy-nilly attack itself without reason. It doesn't just attack itself. This is a beautiful, organized system that is designed to work in our favor at all times, in all places. So homeostasis is the balance. And truly, this was something that was breaking her homeostasis and putting her body in a constant state of fight or flight. And in that constant state of the or the sympathetic nervous system dominating, the immune system was not able to function properly. So helping her shift those alignments and recognize what vulnerability actually is. Vulnerability is strength. Being vulnerable, being in a relationship, loving somebody, being loved by another is vulnerable, and yet one of the most strengthening, reassuring things we can have in our lifetime.
Yeah, you said so much there. One, there's no such thing as a pure strength. There, everything is a pro and a con. We have the law of opposites. Something is going to have a pro to it, and something's going to have a con to it. But when you start talking about autoimmunity, there's a huge link in the medical literature to post-traumatic stress, to leaky gut, to different levels of toxins, which, by the way, I am going to just take a sponsor break real quick. This podcast is brought to you by bettercoffeeshop.com, the world's cleanest, best organic coffee in the world. I'm going to encourage you to try that. Bettercoffeeshop.com, the world's best organic reishi-infused coffee. So now, one, you brought in body, mind, and spirit with this patient, and it was body pain. But I really like what you're doing with teens. So now, what type of pain are they having? Are they making that obvious to you? How do you get that discussion going with them?
Yeah, great question. Thank you for bringing it back into that lane. So we see a lot of emotional distress with teenagers. So anxiety is ubiquitous across teenagers. Depression is rampant. This isolation mentality is certainly there. And then we have, the medication side. There are more and more medications. I believe it's 1 in 4 teens are taking some psychotropic medication. And then there is the physical pain side of things that we see leaky gut. We have more Crohn's or digestive issues in teenagers than ever before. And, to your point, that is an absolute part of this whole process is if that nervous system's in a state of fight or flight, the digestive system is not working properly. Every digestive issue that I've seen, and I don't want to oversimplify it because there is complexity in here for sure, but every digestive issue I've seen in my 20 plus years of experience will have an issue with fight or flight, a chronic fight or flight state. And so these teenagers are in a state of chronic fight or flight. And we could point the fingers outward in many directions, and we could certainly talk further about causes of this, but without pointing the fingers outward, the pain that brings people in is I see people with chronic digestive issues, chronic depression, chronic anxiety, insomnia, eating disorders, failure to thrive. I've had lots of teenagers, high-performing teenagers, who want to quit their sport or quit that activity because of an extreme disappointment they've had. And so helping them to reshape the identities has been a monumental shift, and show them how to do this work on themselves has been a monumental shift.
I want to share, I taught a neurology series in 2009 with a neurologist from Cornell. And what a lot of people don't realize is the brain is going through some profoundly sophisticated remodeling during those teen years. So you see that body changing so dramatically, but the mind is changing just as much. And then when you start mentioning that we have more brain chemistry in our gut than we have in our brain, and then when people are having fight or flight, where they are having anxiety, their digestion is going to be off and they're going to be set up for so many different things. So how does that conversation happen? You have a student and, lead me through that. How are you going to get them to do this exercise?
Yeah, that's great. With my students in anatomy and physiology, and first of all, I am present to these ethical lines that I try to be real careful in my professional setting as an educator, to not lean in as Dr. Matt. I come in as Dr. Ormond of that space, but I want to show them that they can trust their bodies. That just like the rock in the shoe metaphor, when something's amiss, that the body is asking for some intervention. One of the first signs of a lack of oxygen in the body is we'll have anxiety. And so when they're present to being anxious, it's checking the breath and resetting the diaphragm. And we do little exercises like this every so often to get them back into their bodies. And so the overarching theme that I want as we go through every system of the body to bring back to them is that they can learn to really trust these bodies and recognize the miracle that is their body. We call, phenomenon that we don't yet understand completely, we call it magic. And I want them to see the magic on a regular basis of their bodies. So, but a deeper answer to your question of how do I work with these teens is it's typically, the parents, they'll be patients of mine and they'll share something of, hey, can you do something like this, or can you help over here with my teenager? And that's where I lean in. I do a monthly webinar series, and I have a couple of things that I do on the outside as promotional for sharing this program. But by and large, it's been organically through my patient base of speaking into the concerns of those parents and offering this service.
Well, so many different things there to go with as well. I love reading books and by Navy SEALs, and it's hard to imagine a more challenging circumstance to be in a firefight like those guys. But the first thing they're taught to do is take a deep breath.
Yeah.
And I have to wonder, why don't we really start teaching that grade school forward? If we could just learn to take that breath, we could center ourselves, we could move ahead of it. Now, is there any particular demographic of patient that you enjoy or that you think benefits most from what you're offering?
Yeah, that's a great question. My eyes have been, I've tuned in my eyes, my heart maybe to seeing pain and suffering. And so, and it's out there. It is absolutely out there. A demographic that I really enjoy serving. I started as a sports chiropractor. And so I love working with these athletes. I love working with athletes. I was an athlete growing up and loved sports and kind of hit my ceiling. And some of the ceiling was physical limitations, no doubt, but also, dealing with injuries and dealing with injuries, as through an uneducated lens. And so bringing this ability to these athletes to recover quickly and to teach them principles of recovery. The difference between a good athlete and a great athlete is both good and great athletes have a lot of talent, but the great ones know how to recover on the other side. So they're ready for practice. They don't miss games. And by the end of a high school career, that is an exponential in their experience and exposure. And so that's a demographic that I love. And then, using principles from this Vision Quest program that I have is teaching them how to get into a different part of the brain. It's a game changer. Helping them to maintain balance while achieving goals is a game changer. Let's say an athlete achieves or accomplishes an aspirational goal. What do they do afterwards? And typically there's a dopamine crash, and it's a challenge that's there. And then what about the athlete that has a high goal and doesn't achieve it? How do they maintain balance throughout there? And so as we help them redefine their identities, I had an athlete, and there's a whole other demographic that I want to speak to as well. But I had an athlete that he's gifted wrestler and incredibly dedicated. So his sophomore year, he went out and had aspirations of getting at least on the podium in state, and he had the talent to do so. But he overtrained mid-season. He kind of hit the wall and just crumbled by the end of the season. And so that was the time where he decided, I'm done wrestling. I don't want to do this again. And so he was patient zero with this teenage program. And his parents came to me and they asked, "Hey, Dr. Matt, can you help here?" And so as I worked with this young man, as we defined his identities, he found that not only does he have, wants, personal excellence for himself, but he has a strong desire to help others to achieve. And whereas his sophomore season, he focused a lot on himself and doing what he could to improve himself, and really not sharing with others. By his junior year, he started to share and teach and train younger athletes. And that became more fulfilling and more rewarding than anything he had done before. And when we're working, this is a thing I teach in my course, is when we are in alignment with our values, when we're working in our values, we have access to energy beyond our own. And so in athletics, we call it flow state, or in artists, there's a flow state. And we need not wonder how to get in or out of flow state. Flow state simply is being in alignment with our values. And so we can use that list of values not only as an access point or a formula to be into flow state, but it's also diagnostic. If when we're out of flow state, we can look at, well, which value am I not honoring here? And it's simply putting drops into those buckets as well, and we can realign ourselves neurologically into that flow state. And so that's a demographic. Go ahead.
No, I was going to say that's probably one of the best definitions I've heard of flow state. We can get there with whatever we're doing, and that's when time flies. And you look at the clock and an hour's gone, and you thought it was just a matter of minutes. And we can do that with whatever we're doing.
Yeah.
But I like the way you frame that. It's hard to get into flow if you don't enjoy the process.
Yeah.
So you've got that calming chemistry, you've got that focused chemistry, and there's something that's giving you joy. And I'm trying to think of the research. It might be Knee-High Csikszentmihalyi, where he talked about just 4% beyond your current capacity is really the best way to flow. You need some level of challenge, but not a level that actually crushes you. So fascinating that you brought that. And I can see that being very, very accurate. Train hard, recover harder has been one of the things, when I taught sports nutrition around the world, I'd say, look, overtraining should be very, very hard to do, but instead we under recover, and that makes overtraining automatic.
Yeah.
So,
yeah.
Wow.
Well said. Well said. That is such a precision statement there. That's great. I'm gonna borrow that one. Thank you.
You certainly can. So now, when you go to the patients that you're seeing virtually, right? Because you still have something you're doing that. How does that interaction work? And compare that to in person.
Yeah, thank you. It's laughable in some spaces to say that I do online chiropractic.
Okay.
And I don't do it that way exactly, but there are principles within chiropractic that allow for this, right? And so I'll speak into a demographic, and this will answer the question, I hope, is there is a demographic of high achieving individuals. So these are people that are 7-figure income to 8-figure income earners, people that are on top of their game, wherever it is, and typically it's in business. These are an ideal avatar that I love to serve, because they recognize optimal performance. And there are, it's for some, and I don't want to eliminate anybody from who I might be able to serve, but for some it's having to tighten a screw with many turns to get that to tighten up. With somebody who's already high performing, high achieving, it's a 16th of an inch of a turn. That makes all the difference. And they recognize it. When they have energy, when they need energy, when they're able to rest, when they need to rest, when they're able to balance and be balanced in these crucial moments of decision, that is a valuable service. And so I have found my ability to serve these people at a very high level, and they recognize it. So in a virtual setting, it is just that my ears, and I think you have the same ability. My ears now are attuned. I can hear stress. And as soon as you hear stress, the physiology of stress is predictable. Whether you're male or female, whether you're old or young, it's predictable. Brain function changes, it's reduced to the hindbrain. Muscles tighten up, blood vessels constrict, so the ability to deliver oxygen throughout the body is reduced. Our digestive system slows down, and the immune system stops working. And I'll speak one more muscle, a huge muscle, is the diaphragm. And so I've been a student of the diaphragm for 20 plus years, and it's a treasure trove. But when we're into a fight or flight state, it responds just like any other muscle. It tightens up. And so that diaphragm is the primary respiratory muscle, but it is the link between the mesenteric or the early developmental gut nervous system and the brain. And I talked about that diaphragm being hardwired to the hindbrain. And so based on how we're breathing, the physiology will then support whatever emotional state that it perceives it to be. And so that becomes the key. As I'm working with somebody virtually, we're going into and I'm asking questions, and there's a general questions about sleep and energy and diet and cravings and things that give me access points to where their stress might be. But once we find, aha, here's where it's at, we lean in, and we'll find there'll be emotional states that are present, and emotion is a beautiful rock in the shoe type access point to find the balance. And one of the balances that we'll look at is there's two principles that I use, and they'll be familiar ones to you. But the principle is that all things at all times work together for our good. And what I'm not saying, just because it's not as precise, is I'm not saying all things happen for a reason. That's not precise enough to be truth. But yet all things at all times work together for our good. There's truth there. And so when we do the work, the inner work, with a negative experience or a negative charged experience, it's the work is to find, well, how did that serve me? Because there's balance in all things. That's the second principle. There's balance in all things. In our body, we call it homeostasis. So I'll see, I consider myself a glorified electrician, is how I look at the body. And so when these negative and positive ions are balanced, they repel each other. And in Eastern medicine, they say where electricity goes, blood flows. And so if that charge is imbalanced, it stores in the tissue. And initially, that can certainly drive blood flow to an area, but eventually it becomes congested. And so it's deoxygenated tissues, so that tissue becomes less and less vital. And eventually pain will show up, but we find those charges stored in the body. And so our ability to access that and then restore it back into balance and finding out really how does it serve me. This lady I referenced yesterday with rheumatoid arthritis, is we found, how did it serve me? How does it serve me to be vulnerable? And she found things that were revelatory for her, recognized that she was actually cutting herself off from being loved and served by many.
Now, there's some fairly standard questions that you ask to work through that process, or is it just, we're going to be here, we're going to interact, and I'm going to let your question or your answer lead me to the next question? How do you go about getting there?
Yeah, there's a little bit of mixture of both, but it's more on the second side. Once I've engaged with a patient and we are now in this client doctor relationship, and typically these are the high performers, these are the kind of the elite avatar that I work with. We have a basic understanding and a basic trust there. And so there is history that we've taken, and so I know where they've been and where they're at present, and I know where they're going. And so that's is in the frame, and then from that frame, then we start asking questions. And so the art is asking questions, and now we call it level 5 listening. And this is Sean Callagy's work in Unblinded, but level 5 listening is using all 5 senses. And really, in the using the 5 senses is listening for the pauses, listening for tonality, watching body language, listening for what's being said and what's not being said. And in those spaces now, and you perceive it as well as you work with patients, but there's that sixth sense that comes in of like, hey, pause, back up. You said this word. What did you mean by that? And all of a sudden we've opened up into something. We can spend the next 45 minutes in that appointment getting into that thing in that space and find, I call them treasure, but we find gold. And that gold, it remains unharvested until it's harvested. And our body's like a rock in the shoe, it's storing it, and it knows it works together for our good, and it really desires to have that come forward. And so as we're able to open that up and see what that is, people do feel relief and feel, the breath pattern changes, a levity to their body, it does change physiology. But B, on the other side of that, they're looking at wisdom. And in that wisdom they find through their experiences, it creates space for gratitude. And we can have a tragic or heart-to-heart experience. And as we see how it served us, and it doesn't take that tragedy away necessarily, but when we truly understand how it served us, we can actually, with some gratitude, look upon it and see, I'm so grateful. Because of this thing, I have these things. And these things are forever mine. And while that's a momentary event.
Now, how often, are you able to get there with nearly every patient? I'm imagining that there's some people that have had some pretty serious issues, and they have a hard time seeing how it serves them.
Yeah. Yeah. So short answer is yes. I can get there with every patient now. And it was all about mind mastery. And I don't claim to be a master yet, but certainly in the rising towards mastery. And so, uh, where initially when I first started getting glimpses, so I started as a sports chiropractor, and within the first 3 years or so of doing that, I started working on these parents of these athletes, and these parents of athletes would refer more and more patients in. And what was interesting and you've had this experience as well. You can get an athlete's body back in 2 or 3 visits. You can, correct meniscus issues or shoulder impingements. Their bodies are so vital. They have great muscle supply and blood supply and all the things. Uh, and so adults do take longer, but there was a small pocket of patients that didn't respond to care. And at that point, I was really good at structural stuff. I knew how to fix muscles. I knew how to open up meridian pathways. I knew how to restore the ligament communication, which is vital for proprioception, and then restore alignment. So that was a pattern that I knew very well. And so doing that pattern with a small pocket of adult patients where it wasn't responding wasn't intriguing to me. And so asking more questions like, well, what am I missing here? And that's what opened up this pathway to learning more about stress and the physiology of stress. So as I went back to these groups of people, like, well, tell me about stress on a scale of 1 to 10. And all of them, every single one of them was a 10, at least a 10 out of 10. Some said a 14 out of 10. Some would say 100 out of 10. So I recognized right then and there that I wasn't treating migraine headaches. I wasn't treating chronic back pain or neck pain or autoimmune, that we were treating the body's inability to adapt to stress. So that shifted the trajectory. And I studied Eastern medicine for quite a while. And in Eastern medicine, the principles made sense to me by and large until we connected the organ systems to emotions. And I didn't doubt it. I just didn't have a category in my brain to make that make sense to me. And so as I started entertaining more, well, what else besides structural or biomechanical stress? What else causes stress? And here comes that information forward, like, oh, emotion. Well, let's look there. And Dr. Bradley Nelson writes a book called The Emotion Code. And he articulated glimpses that I had had. He articulated and expanded upon these notions of trapped emotion in the body and how that affects the physiology and truly how it affects the fight or flight systems. And so then the rise of mastery has been in my ability to confront patients. I would judge myself. I would judge the others. This was a 55-year-old man, construction worker, surfer dude in Huntington Beach, California. How would he, like, if I say, hey, there's grief here, sir, that's causing your neck pain, how would he receive that? So that was my initial obstacle that I had to overcome. And I referenced Sean Callaghy a couple times already, but I can't be more grateful for the mentorship, the coaching that he's offered. He taught me in a poignant moment. He taught me, Matt, it's your job to share what you find with people. What they do with that information is on them, but it's your job to share. And certainly I can always rise my mastery and my ability to deliver that to people and to share that with context and a framework that's understandable to them. But I no longer judge. I no longer stop anything. I go forward and ask. And as I made that decision, this is back in 2020. As I made that decision, it's changed my career. It has been pivotal, and the access points that people have given me it's sacred, but it's profound, and it's led to deep healing in surprising ways.
So I want you to expand on that concept of access points. So
Yeah.
do they ultimately figure out, wait a minute, this is my source of emotional distress through the right kind of questions? And basically then both of you diving into that together is ultimately what leads them over the top.
Yes, they do. And here's part of the skill set too is, I discovered again early on in my profession that part of our job is to demystify pain. Pain is scary. And when we're left to wonder, like, what's causing my hip to hurt? And, I joke around with my patients all the time that, if we do a Google search of our pain, you're 2 clicks away from cancer.
Mm,
And you've had this, I'm sure, in your clinic
yeah.
and I've had dozens and dozens and dozens of patients that have come in and have asked me, hey, doc, is this cancer? Because they've searched their symptoms. And so, part of that reassurance, and it's just helping that nervous system shift out of this chronic fight or flight state, has been to show them, here's where that pain's coming from. This is a kinetic chain issue down the right side. Hello, little one. which may or may not be causing that disc to turn and cause torsion. And here's that sciatic pain. And as you can kind of explain what we call the pathophysiology to them, it speaks peace to them. And so now not only can we correct the ankle and fix the knee and get the muscle working and take pressure off that disc, but we've also shifted their mind from wondering or worrying about that source of pain. And so that's part of the bigger answer to your question is as we get into these access points, typically it's physical pain that brings people in. And so I'll start connecting the dots with them of, hey, this thing is off, here's where it's going, and here's what the nervous system is saying. And as we get into that point, I'll show them with muscle work. There's muscle testing that's always there. And so I think kinesiology is beautiful. What I would say contribution to the world is it's merged the chiropractic and acupuncture world together through the muscular system. Through the muscular system, it's muscles that move bones, bones don't move muscles. So if we have muscle groups that are out of position, we'll have structural imbalances for sure. And now the kinesiology is connected these muscle systems to meridian systems and organ systems. So when we can use that broader, that more breadth of understanding, I can connect them back into their muscle groups, see how this muscle is not working, and we've made this correction and this correction, and here's what we find in the diaphragm as far as an emotional state. Let's clear that and see where that takes us, and then we go back to the body and we show it to them. And so I'll always temper it with, I'm not saying this thought or belief or identity is causing, but it certainly is a part of this complex.
I'm certainly a huge fan of kinesiology, taught it all over the world for over 3 decades. And it is a tool that shows people, hey, these things are connected, whether it's this reflex point, that nutrient, that emotion, everything else. Dr. Matt, I'm shocked at how the time has flown. I try to keep these at 30 minutes. So I'm going to give you a wrap up with some words, some advice, and then how can people get a hold of you?
Very good. The wrap up is suffering does not have to be permanent. Is if I could help people understand, and I am familiar with suffering, I've suffered for my own follies, but suffering does not have to be permanent. In fact, suffering leads to change. And the word growing pains have been linked more often in the English language than maybe any other pairing. And so pain leads to growth. And so that's something, if you're in pain, and I say if, it's when we're in pain, is what if we could look at it differently? What if instead of killing it, or numbing it, or coping with it, or ignoring it altogether, what if we could lean into pain and just ask, what is it pointing to? And it will always come back with an answer. That's a beautiful thing. And my privilege has been, next to being a husband and a father, my greatest privilege has been walking with people in pain for the last 20 plus years. And to help people discover the purpose to their pain and then resolve it it never gets old. It's the most fulfilling thing that I do. And so how do you get a hold of me is I have a website called heritageofhealthacademy.info. I am on the social media platforms, Dr. Matthew Ormond, on Instagram and Facebook. And it'd be my pleasure to connect with anybody out there that has questions, and just to be a resource is a privilege.
Well, one, thanks for sharing. Two, I wrote the forward, the most recent book that I wrote a forward to, the title was From Pain to Purpose. And so, it's a common theme that people are beginning to realize that when we're moving in a direction that we don't enjoy, the universe is trying to get our attention. And if we learn the lesson and redirect it, we can change things, like you said, like taking that pebble out of the shoe. Sometimes the pain can go away just like that. The gait normalizes and the spillover effect is amazing. I'm just flabbergasted at how the time passed. You shared so much wisdom. I think we're going to have to do another session at some point in time because there's so much goodness through that. Certainly enjoy your little death there. So
a little photo bomber.
Yeah, well, that's the beauty of working from home and podcasts, and get to see that wonderful human, and she gets to see you contributing to the world. How fun is that? So any final words as we wrap up today?
Well, first of all, thank you again. Thank you for offering this platform. Thank you for your beautiful questions. And a final is learn to serve more. This is the opportunity that I have to serve. Service is the currency of the universe. And I've learned that as I serve more and find more ways to serve, the benefits of that, not only it's exponential in nature. So the opportunity to serve on this platform is such a privilege.
Well, thank you for that. I think it was Roy Vaden. He said, service is the price we pay for, is what we pay for rent, right? For our space on earth. And the rent is due every day. So, yep, we want to show up, we want to serve, and you do that so well. So I'll use these words. I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful. So good night and or good day, and God bless always.